Good morning. We are live at St. Luke's Hospital in the Vascular Lab. My name is Katie Maybanks. I'm the nurse practitioner for the Structural Heart and Valve program at UnityPoint Health in Cedar Rapids. I am joined today, fortunately, by Drs. Richard Kettlecamp, Dr. George Hodge, and Dr. Gary Whitey. We are all associated with the Heart and Vascular Institute at UnityPoint Health in Cedar Rapids. We are live today in the Vascular Lab where we perform Transcatheter Aortic Valve Replacements, or TAVR as we like to call it. We are the only hospital in Cedar Rapids approved to perform TAVR. This procedure we began performing this procedure in 2016, and just last month we performed our 100th TAVR. So TAVR is a procedure for patients with failing heart valves that are not candidates for traditional open heart surgery. So today we thought we would get together and discuss TAVR, what it is, and more about how it's benefiting so many patients in Eastern Iowa. So the first question is for you, Dr. Hodge. Would you please explain what happens during the TAVR procedure?
The TAVR procedure involves multiple providers, so it's extremely important to have a team. And the team starts with anesthesia that brings the patient to the room, puts the patient to sleep, and continues with an imaging cardiologist who is specialized in cardiac imaging that puts usually a ultrasound probe down the throat to take good pictures of the heart valve, and then continues with interventional and surgical team, interventional team me and Dr. Kettlecamp, and surgical team Dr. Whitey. Access is typically done through the groin, where surgery and intervention will access the groin arteries to try to pass a catheter from the groin to the heart. And during that time, we are able to see the heart valve through the imaging cardiologist who is helping us as part of the team. So crucial communication here between the different team members. And subsequently, there is also a temporary pacemaker that is used to pace the heart. The heart is paced at a fast heartbeat, and then the valve is deployed while the heart is being paced. Subsequently, after deployment of the heart valve, all the equipment is removed. The patient is usually awakened in the procedure room, and the anesthesia physician will help wake the patient up, and the patient is talking before they leave the room.
Great. Dr. Whitey, can you discuss what are the benefits for our high-risk patients that traditionally can't undergo open heart surgery, and what is the age range this procedure is appropriate for?
Well, while both procedures carry risks, and a lot of the risks are shared between open heart surgery and transcatheter valve replacement, I think one of the keys is many of the risks that we would share that are common are much lower for the catheter-based therapy. Stroke, particularly one of them, bleeding complications, infection complications are much lower of a risk than we see from traditional open heart surgery, so that's one of the benefits that we get from it. Unlike heart surgery that takes 2 to 3 months to fully heal up and recover, these patients recover much faster. They're typically in the hospital 1 to 2 days, sometimes 3, but within a couple weeks they're kind of back to doing their normal thing, unlike after open heart surgery it can take anywhere from 2 to 3 months. So it's one of the major benefits, I think, of having a transcatheter valve. While age is a factor we look at, I wouldn't say it's the only factor we look at. I think many of our patients are in their 8th and 9th decade of life, but we've seen a number of patients due to various other medical issues much younger than that would not be a good candidate for open heart surgery, so this provides them a good alternative option.
Absolutely. And Dr. Kettlecamp, would you talk a little bit about what the patients who are having TAVR say about the recovery, and also touch a little on the future of TAVR for our program?
Sure. I think they're pleasantly surprised at how quickly they're able to recover from the procedure. The procedure isn't particularly invasive, so one of the biggest issues is the access point where we put the catheters, but they recover from that very quickly. In terms of how they feel afterwards, I think across the board patients feel better. In fact, some patients will say how surprised they are, how they didn't realize how poorly they felt before the procedure, and then afterwards, oh gosh, I was doing poorly. And so they seem to rebound. A specific example was we had a 94-year-old woman who came to us, and she couldn't play golf. She was having difficulties golfing, and then we did the procedure, and she's back on the golf course at 94, so that's pretty impressive. As far as the future of the program, we certainly intend to continue to take on more patients. We have more and more challenging patients as we proceed, more difficult procedures, more difficult access points. Additionally, there's a lot of new horizons for structural, non-invasive procedures such as the mitral valve and other territories that we plan on embarking on in the future.
Great. All right. So thanks so much for joining me, guys. And we wanted to learn a little bit more about TAVR, so we wanted to share that with you. If you'd like to learn more about TAVR, you can go to unitypoint.org/CRTAVR, and that's all the time we have. Thanks for watching.